It's a topic that we have talked a lot about throughout the last couple of years, talking about anxiety.
No matter what you do, you may be noticing those anxious feelings. They just won't go away. So what do? Well, Dr. Amy Sickel is a psychologist at Kansas City University. And you have some ideas, Amy. Good morning. Thanks for being with us.
Good to see you again.
Good morning. Thank you.
Yeah.
So tell us, for those, kind of what brings on anxiety?
There can be a lot of different things that bring it on. If it is stress, it's related to a trigger, like an upcoming deadline or talking on the news in the morning. But if it is anxiety, it is something that is more pervasive, and it happens in many different settings. Regardless, though, it's those tense muscles that you feel, quickened breathing, irritability is a symptom of anxiety that people are less common or familiar with.
Yeah.
How do we know the difference between what is anxiety and what may be a disorder or something else?
It is about how pervasive it is. Is it causing problems where you can't sleep night after night after night, or now your worry is so bad that it's, I might miss a deadline, but your brain goes to, I might get fired, I might then lose the house, and your mind takes it further than what is reasonable for that stressor.
Oh, okay.
Yeah. We also often hear about how anxiety manifests overnight. Why is that? Is it because our brains can't shut off, or?
It can't shut off. So we're thinking about, what did I do during the day? What is coming up tomorrow? And so to manage anxiety, it's important to think about right here, right now, instead of the things we can't control in the past or the future.
I like that. Okay.
So talk about some of the techniques that you use to get people through anxious moments.
Deep breathing is key, and if you're willing, we can do a little bit of deep breathing. And since you've been talking about cookies, we will do an exercise related to cookies.
Okay.
But with deep breathing, you need to use the diaphragm. And it is hard to just naturally breathe with our diaphragm. Typically, when we're anxious, we start breathing and our shoulders go up and down.
Yeah.
And that makes us more anxious. But if you smell like a warm chocolate chip cookie, it uses the diaphragm, and then you cool it off, and then you let it out. And so now your mind is focused on that warm cookie, and then you cool it off. But the key is practice when you're calm, not when you're anxious.
Yeah. Okay, that sounds good. And so what are, I guess for those people who try those tips, what can they do if they still have anxiety over a long period of time and it falls into depression?
So one of the keys is use therapy, and cognitive behavioral therapy has been found to be really effective with anxiety and depression. And so you can use a licensed professional counselor, a psychologist, a clinical social worker, but ask what they do and their approach to therapy. And so CBT is one of those effective means for anxiety and depression.
Dr. Sickel, before we get you out here, we have the biggest question of the morning for you. What is your approach to Oreo cookies?
For me, I like to take off the top of the Oreo and then flip it in half so I have double the stuffing.
Original Oreo made to double stuffing. Would you like to sample that for us right now? Here we go.
Demonstrate.
Oh,
Okay.
look at that. She is a pro.
She took it right off.
I've practiced.
Okay.
Got to smell it,
Okay.
cool it off,
Cool it off.
and then you
And
fold
then
it
you
over.
Fold it over, and there's your double stuff right there.
Takes it to a whole new level.
That's why she's a doctor. She's brilliant. She is brilliant, I tell you.
I love it.
Dr. Sickel, thank you so much.
Thank you.
Great to see you. I'm going to try that technique, too. Pat?